Welcome to the latest in our series of TopMedTalks 2. In these podcasts, the TopMedTalk team is in conversation with global thought leaders in perioperative care. TopMedTalk. Hi, it's Monty Mython, Editor-in-Chief of TopMedTalk. We're here at the 7th Annual World Patient Safety, Science and Technology Summit in Huntington Beach in Southern California. Extremely well-known, one of the surf capitals of the world, my children tell me, my son who surfs in particular. As we look out the window here, we can see waves crashing, Pacific waves crashing onto a fantastic beach. We're looking forward at some stage to get out. So I'm here with Desiree Chappell, the anchor for TopMedTalk in the United States of America. And we just, a friend has sat down, Dr. Michael Ramsey, Mike, as I know him as, if that's all right, Mike.
You bet, Monty, yes.
There we go. Who sat down to us to tell us a little bit about why we're here and what's going on.
This is the 7th patient safety meeting, and the whole goal is to try and make our hospital safe. And right now, if you're a patient, the safest place to be is get home. And that shouldn't be. And we know this is focusing on preventable deaths in hospital, but if you look at it in terms of preventable harm, it's enormous. And we have to make the hospital safe. You can't go into a hospital and die of an infection that you didn't have coming into the hospital. People have to learn to wash their hands. We have to learn about cleanliness, basic things to make a hospital safer. Now, we know we're humans. We make mistakes. So how do we mitigate the mistakes? Do we have processes in place? And we really don't. And that's what this organization is about. We're focusing on deaths because in the United States there's probably 200 to 400,000 preventable deaths a year. Incredible number.
Wow. And they're saying it's one of the biggest killers for in-hospital patients. Is that right?
Correct. Absolutely. Yeah. We don't like to admit it, but it is.
That's extraordinary.
And it's the third biggest, actually. We have cancer and heart disease first.
But it's the third.
It's the third.
Medical errors are...
Yes. That was published from Johns Hopkins in the British Journal, not the American Journal, but in the British Journal.
Sensational stuff, isn't it?
Yeah.
And this is the seventh summit, is that right?
Correct.
And you've been to all of them, or are you relatively recent?
No. It just hit my button quite hard because we had a real problem at Baylor with post-operative opioid respiratory depression. And so I was talking to Joe Kiani, who was kind of really passionate about this and put it together, and told him what we had done to correct that problem. And it was something that's really kind of coalesced here in the movement, and that is we sat down with everybody in the hospital related to that patient, including the family. Right. And really brainstormed what could we do. And it was multiple factors, but it reduced 47 rapid response team calls in 1 month on one floor.
Wow.
We now down to 0 to 3, and they're early calls, and patients don't get hurt, they don't get transferred back to ICU. So it made a big difference. It's app number 4 here on this list of apps that we have.
I saw that app's there. I saw that post-op respiratory depression.
That was ours.
Wow, that's fantastic.
So people coming in from the outside who haven't been here before and don't know about the movement, they hear apps and they think about something downloadable on
phone.
the smartphone.
Well, that's
it's not
intentional.
That, is it?
But it's intentional to make you think that because they are downloadable. They're on the internet, and they're APSS.
Yes.
And each one is basically a recipe.
And that's an actionable patient safety solution, APSS.
Correct.
And so you look it up on the website, the patientsafetymovement.org, there's a list of 18. As you click through, it gives you all the what to do next.
Yes.
That's quite a list.
It is, it's expanding, and there's more to do. But it's the best practice that we've got from any institution that's brought it to us, and they can prove it. Yeah. And we let a load of experts look at it, review it, and we want to see that it actually is making a difference. And if you think you've got something better than we've got on the app, give it to us and just show us the data.
So it's organic, open source.
I was just going to ask, is it open source? Do you have to log in or become a member?
No, just log in. It's open. It's open.
Because it's a big tent thing, isn't it? That's what's fantastic about it. Yeah. And partners from all around the world. And this meeting, we've been hearing a lot about this planning for zero. What's the zero thing? And part of the hashtag is EXO 2020.
Sure. I mean, the goal was getting the 0 deaths by 2020.
Zero avoidable, preventable deaths.
Yeah, 0 preventable deaths by 2020.
I mean, that's a fantastic ambition.
It is.
I know people are determined to get there, but 2020 is next year,
correct,
isn't it?
And not only that, this movement's gone global.
Yeah.
And so it's no longer looking at the 200 to 400,000 deaths in the United States. It's looking at the 3 million plus deaths in the world.
Well, I was with you in Sydney last year. We went for a dinner up a tower somewhere.
Correct.
Yeah, and I think you cut the cake with
David Scott. He was president of the Australian-New Zealand College at that time, and they signed on. They committed to the patient safety movement. David's here. He's going to be on the panel with me this afternoon.
So that's true globalism, and the European Society is there, and I know the Royal College of Anaesthetists is planning to join in formally, I believe,
correct,
which is brilliant. So global movement. So I don't want to be in any way, shape or form negative about the 0 2020 ambition, but it's going to be the whole globe. At least we could get to zero tolerance of avoidable harm. Even if we can't eliminate it. Because it's the tolerance of it that's been part of it's been the hushing up, hasn't it? It's been part of the problem.
It's the whole culture.
Yeah.
I mean, the way we're set up, we don't want to talk about it because there's adverse reactions to it, and yet we've got to be transparent, otherwise we can't fix it. And so that's what we're really trying to get to, is that we're very open about what happens. We're open to the patient's number one, and that's what we've got to really protect and let them know what's happened and teach them, help them to be their own guardian in the hospital and their families, and work together. Don't cover up things. Be open about it. Sure, it's going to be expensive, but a life is expensive. Harm is expensive, and let's try and get on top of it and minimize it as much as we can.
Absolutely.
No, I think we have made that cultural shift in the United Kingdom in an acute hospital setting. We've much more. I mean, the youngsters now have grown up. The young doctors have grown up knowing that's the normal way to do things. It's us older folks that took a world to adapt to that idea. Let's hope it all goes away and it'll all be okay, which has been a big change. And part of that has been this concept of the root cause analysis.
Correct.
To err is human, which is a recurring theme here. Bad things happen. If it does happen, let's learn from it. Let's be honest about it. Let's be open about it. Let's learn from it. Now, part of these zero things, you said you went to zero with your opioid thing.
Yes,
so I presume all these examples are based on the fact where people have gone to zero.
Yeah.
It's not a pipe dream, it's a reality.
No, it's a reality, absolutely. Yeah, it's best care. And, we could get to zero.
Yeah.
But we're human, and there are going to be lapses, there are going to be changes, but at least we can have the processes in place that can lead us there. And one that came out yesterday that I think is really smart initiative, and that is putting it in the curriculum of medical schools.
Yes.
And that's what they talked about yesterday they're doing from Geisinger. They put together a curriculum, and I think if that went worldwide, that would be getting it at the roots.
One thing that I appreciated was that it's not just for medical schools, it's for any care providers, anyone that's taking care of the patient.
Yes.
Which is so very important that it's not just from medicine, it's from everyone.
Yeah.
Now, this whole thing is the brainchild of Joe Chiani, who's been introducing a lot of the sessions here, and he's the founder of Massimo, this organisation we know extremely well from pulse oximetry and further developments. It seems like this has become a sort of real passion for him, this whole area of patient safety.
It is, absolutely. He's the driver, no doubt about it. But he's passionate about something, he makes it happen. I mean, he was not the first pulse oximeter in the world.
No.
He came in and he just looked at medicine because his sister was in medicine and looked to see he was an electrical engineer. What can I do to improve healthcare? And he looked at the pulse oximeter and thought, I can do better. And in his backyard, in his garage, he and a friend put together a better technology. And, he sets his mind to it. He can do it.
And the great American dream was, he's a migrant.
Yes.
Father an engineer, mother a nurse. That sounds like my family.
Really. Yeah.
Great, amazing from not being able to speak English through to graduating at 22 with 2 degrees in engineering. And one of my children is doing engineering, and I think she should stick at it because it sounds like engineering is a great thing. Well, that's brilliant. We're under time pressure because we've got some other people coming along this afternoon, and apparently as a result of that, without giving any clues away, the Secret Service have said we've got to move our table.
Yes, that's exactly right.
Mike Ramsey, thank you very much.
Thank you.
Thank you.
Take care.
Cheers.
Top Med Talk.
Nick Majerison here. Thanks for listening to Top Med Talk. Now all you need to do is find us on social media. We can be friends on Facebook. We can follow each other on Twitter. We can hang out on Instagram. Or we can even gawp at each other on YouTube. Get onto your social media platform, whichever your favourite is, and you're likely to find Top Med Talk there. Whilst you're at it, make sure you've subscribed to this podcast so you never ever miss an episode. Helps us enormously if you do that, by the way. And check out the website, topmedtalk.com. On there you can find the email updates where we update you as to what we're doing each week. And whilst you're online, whilst you're doing your thing on the internet, I highly recommend you download all of the podcasts that we've put out here on Top Med Talk. We do an enormous amount of material here. A lot of it is incredibly valuable and, of course, will be in the future. So I just recommend you download the entire back catalogue if you could. Helps us out if you do that as well. And check out edpom.org/meetings, because if you go on there, you can find out where we're recording and what we're doing, because we go to the big meetings, the EdPom meetings. You may have noticed most of our material comes from some of these wonderful conferences that are organised by evidence-based perioperative medicine. So EdPom, ebpom.org/meetings. Get yourself on there, and why not check out the Dallas Masters course, Perioperative Care Practicum. Hopefully I'll see you there.